Chiropractic's vlogcast. I'm Dr. Adam Reese. Today we'll be discussing three closely related conditions which affect millions of infants each year. Colic, constipation, and infant reflux are some of the most common disorders with which babies come to our office. For the most part, these can all be considered problems with the child's digestive system. Now, some of you might already be wondering, babies go to the chiropractor? And if your experience has been with a conventional chiropractor who looks to temporarily manage things like neck and back pain, then that's certainly a legitimate question. At Keystone Chiropractic, we do things differently. Our focus is on structural correction, and not only helping our patients feel better, but function better as well, regardless of their age. We look to detect problems with the body's most important system, the nervous system, and determine whether shifts of the spine are obstructing proper communication between the brain and the rest of the body. Regardless of the nature of delivery, whether a home birth or a C-section, the birth process can be a traumatic event for the child. If the infant requires any type of manual assistance in being delivered, anywhere from 60 to 90 pounds of pressure can be placed on the upper spine. The use of tools such as forceps and vacuum extraction can increase the amount of pull placed on the spine. You can see then how this may lead to a newborn spine shifting, affecting the function of her most important system. These shifts are often a contributing cause to the conditions we'll be discussing today. Colic can be described by the rule of threes. 3 or more hours of crying per day, for 3 or more days per week, for 3 weeks or more in an otherwise healthy baby. It's also characterized by clenched fists and flexed legs. While little is known about why a child develops colic, what is understood is that it's related to digestive dysfunction. Restoring normal nerve control through structural chiropractic has demonstrated a 94% improvement in colic and a 67% reduction in the amount of crying. Constipation in infants can appear as fewer bowel movements than usual, pellet-like bowel movements when they're typically soft, or no bowel movements at all. This often occurs not due to diet, but due to an obstruction of normal nerve control of the child's lower digestive system. Shifts, particularly in the base of the spine, known as the sacrum, and the lower spine, are found to lead to constipation. Infants often begin to see relief from this condition after only a few gentle structural corrections. Infant reflux occurs when food and stomach acid backs up from the baby's stomach. Now, typically infants have some amount of reflux. However, there are a few key things for which to watch. Forceful spit-ups or projectile vomiting, yellow or green fluid in the spit-up, lack of weight gain, or spitting up blood, or the spit-up having a coffee ground appearance. Most infant reflux is caused by a weakened or poorly controlled esophageal sphincter, which is basically the valve that keeps food in the stomach. Often, a shift in the mid-back of an infant obstructs the proper nerve control to this part of the digestive system. Gentle structural corrections have been shown to reduce the frequency of these symptoms and improve feeding and calmness. Chiropractic care for infants and children has been shown to be both safe and effective. There's no twisting or cracking associated with the correction of a baby's spine. In fact, babies only need a gentle adjustment, like the pressure used to check a ripe tomato. It's best to look for early signs of nerve system obstruction to help prevent secondary issues as the child grows and develops. At Keystone Chiropractic, both Dr. Megan and I have additional training in caring for infants, children, and pregnant moms through the International Chiropractic Pediatric Association, or ICPA, giving us the tools to best serve you and your family. If your child has experienced these problems, or if you're looking to optimize their well-being, contact us today to learn more. Thanks for watching today's vlogcast.